you need is you take your time, get a good anesthetist, put the person to sleep, or do spinal epidural, and then you take it one after the other. When you finish, make sure that you close it tightly. When you close it tightly, she will not bleed, and she will go home on her normal third or fourth day. And don't sign double consent. There's what they call double sign consent if you really need your uterus. Okay? When you come to a place for surgery and they tell you sign double consent, don't sign it. Double consent means that if I enter the theater and I'm not comfortable, I should remove your uterus. Don't sign those. No matter how they explain, say we get in there, we're going, in case we have to, in order to save your life, we remove your uterus. No, you need your uterus. And we need to preserve women's uterus. Because when you remove such uterus with all those flimsy excuses, the woman is going to have a lot of psychological problems. Because women in Africa don't play with their uterus. They don't. They don't play with their uterus unless whether uterus they have finished having their babies and they feel that, look, I just need to get it out and have my lives and manage my children. But for the woman who has no baby, or who has just want a child, you don't tell her you're going to remove her uterus. So, and the other myectomies, those ones are still coming into Nigeria. They are still on experimental. Okay, there are a lot of other ones. Even there's one that they call which is now raining, which is an ultrasonography focus on sonographic distant ablation. Those they are all there. So it depends on which one you require proper counseling, proper counseling, proper counseling. Or what you are counseled and you are told what to expect. Does it lead to infertility? Answer no. Answer no. The reason is this. Fibroid can cause subfertility, not actually absolute. The answer not infertility unless it block the two tubes. Many a time it could only be one. So the word subfertility means that if you remove it, can still have a baby. If it's a submucous, it can cause miscarriages because if it's planted on top of fibroid is hard. The baby may not have a root, may not adhere properly and detached. And those ones that have subfertility, submucous fibroid in the inner lining, they're the one that bleed. Fibroid surgery is done when, one, it is very big, where we expect that the distance between the vagina and the tube, for the movement of the sperm may be long, may be very far, and may cause subfertility. You may have to remove it, and the uterus will shrink. Number two, when there is symptoms, either it's causing you to urinate frequently, or it has twisted and causing you pain, or it is causing a lot of bleeding. In that case, life is involved and we must remove it. Otherwise, you can conceive with it and we manage the pregnancy. What we need is, it may be coming too big. You can put in a sacrilege and lock the neck of the womb and put the person on some progestogens for quite a long time to keep the uterus quiet so it can carry the baby. So those are the things we actually do. Okay?
Yes.
Otherwise, fibroid surgery, if you can do it and avoid touching the tubes, the woman will conceive. Removing the fibroid that's close to the tube is important, that you don't go near those tubes. It is actually tampering with the tube that causes those infertility. But if you have other condition, hormonal problem, in addition to fibroid, after removing the fibroid, the hormonal problem may show up. And it is not because of the fibroid. Let's say somebody has a fibroid in the cavity and you're bleeding, and you have PCOS. You'll be bleeding all the time, but immediately you remove the fibroid and the bleeding stop. You find your menses may prolong for 3 months. And if you do hormonal profile, you find you have PCOS, so you manage PCOS, and you now have your baby. Okay? So that's a little I can say, because all these things you are talking, each of them is a full textbook. And we cannot exhaust it this night. Thank you very much.
Wow. Even me, I've been writing notes, like taking notes, like I'm a medical student. This is taking me to a question that I know bothers a lot of people. And it's the question of difficulty in conception. What advice do you have? What are these likely causes for this issue? And what do you advise women in this situation to do? What can they do to get remedy? And I sincerely, it bothers me to a lot of time, and even from the things you have said, I just kind of, what can women in this situation do?
We're a Christian family, first of all. So I'm going to talk from the point of view of Christians. Now, marriage is by faith. We walk by faith, not by sight. And that's the reason why these days, a lot of people appear in the hospital, they want to know whether the man is okay and the woman is okay. But I still tell them that no matter what you check, if the cervical mucus is hostile to the sperm, you will still not conceive. So there are a lot of factors, there are multiple factors responsible for delays. One is that when we are managing them, we manage the couple, not actually the woman. Because it takes two to tango. There's a male factor, there's a woman factor. The male factor, the problem we have now is because of this global warming. Right, over 70% of men have low sperm count. Because the ozone layer has been torn by industrialization. So, and the testis is under the leg. The testis is between the two legs there. It's exposed to hazards of life. Exposed to heat. Exposed to global warming. And another thing again that the urologists have spoken is about our food. They are chemical, refined food we eat. They say they are not very good for those germ layers of the testis. And then repeated infections. So these three things are there. And as men grow older, from the age of 30 years, the hormone called testosterone for men diminished by 1% per year. So a man who is actually at the age of, let's say, 60 years, okay, you will have mind that 30% is gone, so he has around 70% of the hormones. I'm not saying that is going to cause effect, but the reality of it is that such a person cannot be the same as a young boy at the age of 30 years. They're not the same. And the same thing comes for our ladies. One of the problems we have now is that many of them present very late. Somebody married at the age of 25 is coming to the hospital at 36. And you hear people say that 10 years. I ask a simple question. 10 years, where did you go to? Because most of the problem may be just only prolactin that you need to suppress and then conceive. Or maybe simple advice and counseling. She tells you that the first 4 years, she was at home believing God. I didn't say she didn't believe God, but she know diagnosis. Even if you're going to a church to pray, please go with a diagnosis. And if you love God to dispute the doctor, but we'll go for a diagnosis. Even all this, the centers where they do prayers and all this, they'll tell you that the doctor says it is this, but God has changed it. We are happy that God has changed, has healed you. We are happy. We're not contesting with God. We're not quarreling with God. Because we have in Nigeria this attitude whereby it appears that the doctors are quarreling with God. No, it's not true. It's not true. That's why hardly the word infertility. We use the word subfertility. Because you can't say that you have explored every avenue to get a person conceived and they didn't get conceived. People are having IVF. People are having surrogacy. Surrogacy is so much in Nigeria. But people don't know these things are going on. So the reality, and people are conceiving with medication. And these herbs and medication, they are all produced from God. God is the one that produced herb. He's the one that produced drug. Most of these drugs, I started with pharmacy in 1980 at the University of Nigeria in Soka. And they call it pharmacognosy. That is, you transform the animal products or herbs into medicine and you compound it. So it's not that we are creating a new, as if there's a quarrel. No. So many people sit back at home and report The question, when do you finally report after 10 years?
Mm.
If you don't want, why not after 1 year? Because you see, the reality of it is that before you talk about infertility, a study was done. 100 people on ovulation day, the men were found normal sperm, and they met. On the ovulation day, only 60% conceived in 6 months. Then after 1 year, another extra 10%. 2 years, another 10%. So they discovered that fecundability, ability of a woman to conceive one cycle, differ from one woman to the other. Some women would conceive the first cycle. The other one may take about 1 year to conceive. So we now believe that once a woman and a man are cohabiting, living, and having sex about 3 to 4 times in a week for a period of 1 year, then you can investigate them. But the question is in that. The question is they don't do that. So this must be there. The man is in Kano, the woman is in Lagos, and they only meet when they think is ovulation. Look, there are cycles that are anovulatory, normal cycle. The woman sees her period every month, but she's not ovulating. So they call that cycle anovular cycle. And everybody believes that ovulators on the 14th. It's not true. It's not true. So you probably need to do some investigation to be sure that you're ovulating. And that would be good. So those early investigations, they are not things that they are not, what will I call it? It's not something that you need to go and book it here and there. It's just simple scan, do follicular tracking, check their hormone, and then give them counseling. The people above the age of 35, you don't wait till 1 year. 3 months, anytime they come to the hospital, start investigating them. And you tell them what may be within medical knowledge what it is. And you trust God and give the little they can. And many a time, many of them conceive. And those who conceive, they don't come for testimony because God has done it. And it's not the doctor. So, age of marriage is important. Age of presentation is important. Sexual habit is important. It's very important that we take these basic ones. Under 30 years, if you open a woman and see an egg above 35 and egg below 30, they're different. You will see eggs everywhere, and after 35, it's scanty. But that notwithstanding, when they present, they should be able to run through all the tests. Another problem that hindering our conception is poverty. Somebody comes to the hospital, cannot even do anything. She tells you she doesn't have money. The man said, I'm just a teacher. And there's nothing you can do about that. You only simply counsel them and let them trust in God. Otherwise, early presentation after 1 year, you can start so that they will know their option. Number 3 is because many health officers are emotional. Please, when people come to your hospital or come to a place, and you have finished investigating them, tell them the report, the answer, the report they bring to you. Tell them what it is. Don't tell them, no, it's not a small, it's a small thing, but God, no. Tell them what it is. Many times we are not truthful. We are not truthful. Even when people come with some results that says it's cancer, tell them what it is so that we chase a black goat during the daytime. We waste patients' time. We don't tell them the truth. And they hang. The other 4th one is ignorance. Not every hospital that does antenatal is a obstetrician or gynecologist. You must look for a certified gynecologist so that he will discuss with you. I saw a lady who came yesterday, and a woman, we went to somewhere and they opened her up. And they said that they couldn't do the surgery again, and they closed her that she should go to a gynecologist. Question, why did the man open her up? And she came to my place and sat down. I was crying. The question, what will I do? Will I open her up again? What did the man see? And who is he? Now you want her to go to a gynecologist. Why did you open her up for? Were you supposed to open her up? So these are all fraud and all things we do in the country here. And it appears that these women are just there being moved up and down. Meanwhile, if they have come in presented after 1 year of their marriage, what they may need is only counseling, no treatment. Counseling to just encourage them on what to do. But many people during the ovulation pain, they bleed. And they may be worried. They don't know that ovulation can induce bleeding. Because when the egg ruptures, it bleeds. And at times you may see stain of blood in your vagina. But that does not stop conception. So they need counseling. Some people, the ovulation pain, may tend to withdraw from their husband, especially the young ones. And you need to counsel people about what to do. And then they will be able to interact with you. We don't do this. All these things are done overseas. They're done overseas. Whereby we call it prenatal, clinic. People who are intending to have babies come to hospital as couples, sit down and discuss with the doctor. But they're not here, they're in UK. They just discuss. Those who are diabetes, you be able to manage them for the diabetes, change their drug. Those hypertensive. So we manage them and prepare them for conception. But unfortunately here, everybody looks at the hospital. What for? Because I know there are 3 places that people don't want to actually spend their money. 1, church. Number 2, they want to the hospital, and then thirdly, in schools. So, and these are the ones the wives brought in. But if people can, after marriage, go for counseling. In short, during the counseling section in the church, there should equally be, no health issues should be discussed. Couples must be counseled on this line. Counseling must be holistic, must be every aspect, because their health issues coming. These couples are not marrying for photo show. They are marrying in Africa to have baby. We shouldn't just pretend it. After the euphoria of honeymoon, they want baby. Let it start discussion. So that they will begin their journey of life, decide when to start having their babies. When we're having your babies, what are you going to, when you're pregnancy, what are you expected? All these things should be holistic counseling, but unfortunately, these 2 people, this is a virgin, they married, they have never had baby before, they don't know. The first 2 years, they are grumbling about, they don't know what to do, and they don't even know where to go to. It should start from the counseling. So, fertility is the man's part, the woman's part. But the important thing is that they should present themselves after 1 year. But how it's going to be done, those ones are left for the gynecologist. Thank you very much.
Wow. It's an eye opener. That thank you so much, gynecologist, for that. I'm going to push like 3 questions to you, and I'm going to open the floor, the house, for any questions from the participants. One of the questions I want to ask, because of the last thing you said about young couples, is the question of sex. A lot of times women experience a lot of pain. Even maybe someone that's just even starting experience painful pain during intercourse. Even some people, when they have even given birth to other children, they still experience pain during intercourse. What do you think is a cause of this, and what should a woman do if this happens?
You see, painful sex, they call it dyspareunia, which is painful sexual intercourse. 2 things involve the penis, the vagina. Okay? The first one is a young girl is a virgin. And if she's raped, that memory lives in her. So anytime the man approaches, she's going to be frightened. The vaginal muscles are going to contract. And that's why called vaginismus. Some say it's vaginism. The issue is that the contraction will tighten the place. The vagina has a muscle called gracilis muscle. Gracilis muscle is called custodian of virginity. That is why before a girl says, I'm raped, we must see blood and injury. Because if you close your leg as a girl, as a lady, no man can open it except injuring you, except forcefully. That muscle tightens the vagina that nobody can enter it. It's called gracilis muscle. Now, when a girl is raped, that issue comes up. Anytime a man approaches her, or with her husband, that muscle will contract. So that spasm will lock the place up, and she's going to have pain. Number two, so when a person is married, their first intercourse is very important. It must be done gently and carefully. If it is done and the lady perceives pain, that's the beginning of a period of pain in her marital life. So that thing is important, and I need to re-emphasize on it. If you are entering and you two of you, and you know you are not with, because if the marriage comes during that distance, there should be a foreplay. There should be a foreplay. That foreplay is important for you as a lady to lubricate your vagina and the introit to the entrance. If it is not so, maybe because you are afraid. Because one of the problems we have is that our upbringings, many times, they desensitize us by our upbringing, by believing that if a man comes near you, you will conceive. So you carried it into a marital relationship. So whenever the young man is coming, your mindset is, I will get pregnant. And the Bartholins will release nothing, because the brain will not send any message to all those organs that secrete those lubricants. And if that continues, you will have. So once the vagina is dry, because the penile shaft itself is rough. The penis is rough. Because in the course of sexual intercourse, if we are excited during orgasm, the vagina balloons out to accommodate the penis, because it's elastic, has some elastic fibers. And the penis elongates. That's what causes. So during orgasm, the vagina contracts, and the semen are taken in. So if, for instance, you are not relaxed during the intercourse, you must have pain. Some people say, yes, size of penis matters, yes. I've seen one that I was really shocked. And because it was abnormally too big penis. Yes, that one, there are very few cases of that. But it's not common to have such sizes of penis. But most of the time, it has to do with your dryness. It has to do with the man. And another thing again, despite the fact that our parents suppressed our psychological sexual development while we're growing up, now the church itself should tell people to close their legs and open their minds. So because of that, I went into youth teenage ministry for 16 years. Whereby a boy sit, a girl sit, they should close their legs and open their mind. Because these people are going to grow to marry. And it shouldn't be an issue. It's a normal God development, psychological sexual development of every child, every woman being born on earth. God endowed us with it. And we shouldn't allow culture to just kill it and ignorance. Because the whole thing we are afraid of is the girl getting conceived and having baby. Let her close her legs. And let the boys zip up. Do you hear what I'm saying? So you're not going to force yourself into a girl and close her legs. And I'm going to open your zip. The penis can't jump out. So I trained these young people, and many of them married a virgin, but they were okay. They were okay. And they had a very good. Anytime I go to that church, I see them with their families. They're looking good. Because I told them that those areas should not be desensitized, because they are natural endowments from God. And we cannot, for sake of religion, not Christianity, in those areas. So people are entering into marriage already desensitized. And therefore, the lady has no urge. I made a lot is becoming commoner now, whereby ladies don't have feelings at all. Feelings, beautiful girls, no feelings. I met some time when I was in the house officer, that one looked at sex as a movie, and they lost about 5 marital relationships. She sees it at what she sees in YouTube. So the question I'm asking ourselves is, painful menstruation, painful sex has to do when your vagina is dry. But those glands that produce those lubricants, they are there. It's only your mind that is sick. So you need to now start changing your mindset to believe that this here. Another thing again, that these days you see ladies and men, they hold their hand and walk along, brother and sister. Unfortunately, you're desensitizing yourself. People don't think and say, no, we are not doing here now. At a particular stage, you begin to see your husband as a brother, not as a friend. It's our mindset. If you see your husband as a brother, you can live in the house for a whole 1 year without having feelings. And the man will not be questioning, because most men are sensitive. Most women are suppressed. Because parents in Africa believe, in Nigeria, believe that the girl child should be cautious from getting pregnant. But a young man must be at home by 5 o'clock and will not be seen around talking to anybody. And that's how you have been. You understand me?
Yes, sir.
It should be. That's to do with the mindset.
Yeah. Thank you so much, sir. Thank you so much. Just 2 questions from my hand, and please, if you have questions, you can drop in the chat room, or if you want to ask, you can just raise your hands. There's another question is about family planning. A lot of women, when they have given birth to all the children they want to give birth to, they want to go and do family planning because they want to be able to have sex and enjoy sex without any restraints. So we want to ask, what kind of family planning procedure is safe, and even if they have side effects or without side effects, or even if they have side effects, what are the side effects and how can they be managed?
There's no family planning that is except the one you tie the tubes, BTL, which is a permanent, irreversible family planning. The other ones have some level of failure rate. Some people are good in hormonal, they don't add weight. But the problem of hormonal is irregular bleeding and weight gain. The coil is okay, but the problem with the coil is the risk for Candid infection because of the trade. We've done a lot of trainings on it. They say we should leave the trade. We left the trade and we discovered that the trade was bringing more infection, and the husbands sat in their finger, pull out the trade and pull out the free. So we start cutting it again. And many prefer, but the good thing about the coil property is that you will see your period every month. For the hormonal drugs, hormonal injection, your period may disappear. And women are so much attached to their period. And for those who bleed with copper T, we have Marina. Marina has an inbuilt noretinestrol in it. Those ones have a local action on the lining of the womb. It doesn't allow for excess bleeding. So but the only problem with that one is very expensive. It's a little bit costly. But these days, people are affording it, Marina. So for those who have heavy bleeding, they use Marina coil and put it and leave. After 5 years, you remove it. But the permanent one is BTL, bilateral tubal ligation, which can be done as a day case. Finish in the evening, you go. Just a 3 centimeter incision. You hook out the tubes and tie it. But that's a permanent. Outside Nigeria, in Gambia, for instance, I work there in their teaching hospital. Women, after they finish their family, they just do BTL. The Nigerian know. They have this in mindset that in case my husband say it's no more married, I'm married, or maybe my husband died, maybe my children died. So they have this mindset, in case something adverse happen in future, I will be able to have my womb to conceive or tubes to conceive. And because of that, women don't submit to BTL except those who have done CS many times. And they want to tie it so that they won't fall into risk of death. That's all. So otherwise, I think it's the right thing to do. Okay, the important thing is just you maintain your hygiene, and then you will not have all this yeast infection. And if the yeast infection come, there are a lot of insertions to put and drugs to use, and that will stop. So that's what I think. Because women are attached to the period. The injectable can add weight, and women don't want weight gain. And there are people who use it, and they don't add that weight. It's a principle of your own makeup. The lipophilic factor. Some have very high, some have low. They can not easily convert their glucose to fat. So many are just an individual thing. But to me, I don't think there's one that is better than the other. It's a function of you. You come into counseling, they do family planning counseling, and then you make a choice. And then if you're doing one and it's not doing well, you stop it and change to another one. But the important thing is that women should accept it. When they're asking about men, whether men can do their own, I said no. The reason is because even after men have done it for a period of a very long period of time of over 6 months, they will still be secreted. But that is not issue. Men have a lot of, because they are controlled, their sexual erection is controlled by their 5 senses. When a man feels that he be castrated, that's what they call it, that I'm no more potent. Because that's how they interpret it in their mind. Their penis will not get up. It's not because that thing stopped the penis getting up. It's because of the depression that I'm castrated. So many a time when those things are done, the man with his ego feel that I'm not a man, and therefore he doesn't perform. So the purpose of it is defeated. So that when they come to me, I said, don't try what you cannot finish, because you will end up with this man. Once he lying down and you tie the what do you call it? Think that you am not, the way you interpret it, so I'm not a man again, and therefore you come to bed and nothing works, and you don't know it be purely psychological, not because of what he did. So I think that you make a choice after counseling, that will be okay for you. Thank you very much.
Yeah, thank you so much, sir. Thank you. My final question from here, because I know we've taken so much of your time, is menopause. For every woman, it's like a journey we have to embark on someday. By God's grace, everyone that has long life. So we want to ask, what are the symptoms? What are the things to expect pre-menopause? What are the things? What are the symptoms that comes in menopause? So that if these things happen, we won't be caught unawares. It won't be something that will make us to start being anxious of what is happening to me and all of that. We have a we'll be preformed about them. So we would like to know, what are the symptoms, what are the things to expect, and what age?
Menopause, actually, the word meno means menses, pause means pause. So once menses stop, it's called menopause. It's an event. It's not a period. The period preceding menopause is called premenopausal period, and they come with symptoms. Menopause can be premature before age of 40, can be early between 40 and 45. But between 45 and 55, it's actually the period with the average of 51 years. And once it stops, one of the things that people must know, that even after menopause, you can still conceive. Most times the ovarian function is still a little bit very low, not totally aborted. Now, when the premenopausal symptom, things you expect is that, at the beginning, at adolescent, your menses is irregular. towards the end is irregular. It comes, it goes, it's heavy, it's scanty, comes every 21 days. At times it comes after 35. So those irregularity come because the in down. So what happened for the adolescent repeats at the before menopause. When the menopause comes, period ceases for about a year. You now know that menopause has come. And then you now start seeing all these hot flushes. Not everybody has hot flushes, or flashes or flushes, whichever one it is. So I'm calling flashes or say flushes. Okay? You will just see a sudden heat, and then you see sweat, and then cold. Okay, some depression because you believe that things are going. Okay, the breast become weak. You add weight, do your arms and then your trunks. Okay, and the vulva gets thinner, then vagina become drier. A lot of changes occur in a woman because the estrogen has been withdrawn. The estrogen has been withdrawn is actually responsible for all these things. Then the bone pain comes because now the calcium in the bones are returning back. Most of these menopausal periods for women, especially early ones, are people who are within the middle age. And that's when they still have other burdens concerning their children, concerning children in the college, children who are in the university, and that add to their depression and add to their crisis. So the men need to walk along with them. So it has to do with ability of people to understand when the menopause has come, what are the symptoms, what are the feelings, and be able to intentionally manage it for you to pass through that period. And you need a lot of support, especially for the married. For the married people, you should understand, go for counseling. Some people think it's typhoid, some people think it's one thing or the other. When they come to the hospital, they run simple lump test, follicular stimulating hormone. Once it is high, doubled, you know menopause has come. There are tests to detect that menopause has come. If you have fibroid and it's in the inner lining of the womb, you keep on bleeding even after menopause. Okay? But once you remove the fibroid, menopause, the bleeding will stop. So what you do is that when women are over 50 years and they're still having bleeding, simply do FSH. It will tell you that you're menopause. And then you now know what is the cause of the bleeding, whether it's cancer of the endometrium or whether it's some cause fibroid. Okay, so you have to do with which symptoms you present, the headache that comes. All these things are hormonal. They are all hormonal. Withdrawal of estrogen is responsible for most of them. Thank you very much.
Thank you so much, sir. So I have 2 questions in the chat room. I'd like us to treat them before you go, sir. One says, and what could be the cause of a recurring yeast infections for the past 6 years? She said it started when she was pregnant with her first child in 2019 and it's been consistent. So she has seen different gynecologists over the years. They've done pap smear. It goes whenever she's given treatment, but comes back at least a week after. Please note that, she said, please note that I have changed on this, practice all kinds of hygiene instructions from the hospital, and I eat clean, all to no avail. Sometimes they will say it's yeast infection, other times they will say it's PID, staphylococcus or UTI. She said she has also been tested for diabetes and other things and came out negative. She said, can this have to do anything with hormones given that for a couple of months now, it happens immediately before or after her period? What can she do? Can hormone profiling help?
It's a reinfection. You see, there are times, like I said before, it can resist all those drugs she's using. All these kind of things, clotrimazole, many of them have been abused. You know, one of the problems Nigeria have is the abuse of drugs. In a village, just Senegal or those areas, you cannot walk into the pharmacy and get anti-malaria. There are a lot of places in Nigeria, West Africa. Nigeria is actually. So people use it carelessly. And many times people don't complete their regimen. They don't know the case of this person. Now, if the infection the lady got is resistant to clotrimazole, the one he contacted from within the environment, that means using clotrimazole will not work. That's one, drug resistance. Another thing again is reinfection. You see, when you look into, if you do a speculum and look into the vagina, you find that the thing is like a paste on the wall of the vagina, a whitish, creamy paste. Those ones don't actually go. They only temporarily are relieved. So what I do at times is I take the person into maybe inside the ward and use normal saline to wash the vagina. Because it's not inside the uterus, it's not inside the vagina, the cervix, it's inside the vagina. How did it in the vulva vagina? That way I call vulvaginal candidiasis. So I use normal saline, which has the same osmolarity with your blood, and wash off the whole place. And then you start insertion. It's not about discarding your pants. It's about, I encourage them to use disposable pants. During that period, when they return back, they should be shave their hair and use only gown. Leave trouser tight and nylon pants for a while. Many a time, some of them get well. You should study have been shown that some people even have to put yogurt inside the vagina to ferment it to create acid. I told you, pregnancy is one of the periods that a woman is vulnerable to have candidiasis. But follow-up is important. Because it is reinfection. It is reinfection. It's not that it is so here. And what I tell you, stop misinfection, the UTI is not. UTI is a different urinary tract infection. It has to do with bladder, urethra, and the ureter and kidney. We're talking about vagina and vulva candidiasis. They don't have anything to do with those. All these candidates, all this stuff, I've told you that those things are normal things you can find in the vaginal orifices. It's not what you should. Don't allow people to get you into this stuff issue. Focus on candidiasis. I don't know which medication she has used. There are still new medications coming up now. Lyme fast, fortunately, a lot of them coming up. And many of them have 3 ingredients in one. It could be bacterial vaginosis. That's coexisting with it. It's just a matter of, and some of those ones you cannot torture them in our common lab. What you can only find is the yeast. So occasionally we just have to join it with some other drugs and then manage them together. But to tell you the truth, candidiasis is very difficult to cure, especially when it has stayed too long. And then it has stayed and plastered itself on the wall of the vagina. So what you should do is go back to your doctor. Let them use normal saline and wash that vagina. Wash it very well. And then before you start your insertion, it's not inside the womb. It's just in the vagina and the vulva. That's my own contribution. That's how I manage my own person. Thank you.
Thank you so much, sir. I believe that person has an answer to a question. Another question, sir. She said she has been married for almost 9 years and husband has testicles like that of a child and no sperm count. She said they have tried both traditional herbs and IVF treatments, but all has failed. She said, is there still hope for conception for her?
There's a testicular atrophy. That means there is no testis that is producing anything. Yes, with God, all things are possible. But medically, we encourage those people to use donor sperm. That's the truth. Those are the people who ask for donor sperm. And unfortunately, Nigerians don't do donor sperm. Okay? So let her just trust in God to assist her. Because if the testis is that small, means that it has atrophied. It's different from where a normal testis is not producing sperm. And those ones have been managed, whether it is an obstruction. You can use a man's sperm or open the testis, get the spermatid, and do an IVF. But this is a situation whereby the testis itself has atrophied. Medically, no. But spiritually, God can do all things. That's my answer to that one. Or they can now look for donor sperm or adoption. That's only what I think you should do. Good?
Thank you, sir. We have
Yes, ma'am.
okay. We have 2 more questions. Questions are rolling in, but I would be fast with them. This person says, in case of delay in childbirth and test results taken by the couples proves that the man is the issue, which specialist doctor can the man see?
Urologist.
Okay.
The urologist.
So the woman sees a gynecologist.
URO. The 2 of them can see them. Gynecologist can manage the 2. But if it is where you need to assess the testicles, because occasionally you may have varicosity of the testis and will need a surgery for the testis, the urologist does that. By the excess, because the veins, if they are dilated of the testis, they cause a lot of heat around the testis and can kill the sperm. So he ties those varicose veins. He dissects them out and tie them so as to reduce the amount of heat coming to the testis. And many times he proves the sperm and the woman conceives. But if it is low and the man's sperm is low, there are medications for the men. If it's not improved, then he should do an IVF, because what you need is only 1 sperm for ICSI in IVF, just a sperm only. And many a time they have over 10,000. So what he needs is just 1 sperm. So enter IVF, okay. And then the other one is the urologist can examine that testis and know whether there are varicose veins. And then once it's done varicocelectomy, it can improve her sperm quality.
Wow.
Any other one?
No, there's no other question. Someone is saying that she wouldn't mind consulting with you as regards. Someone just sent in a question. Let me quickly read it, sir. My question is about cysts.
This is about Bartholin cyst.
Yes.
The vaginal swollen Bartholin cyst, okay? If there's a blockage, it is the cyst, it is that gland that produces the lubricant during sexual intercourse. If it is blocked, when you excite it during intercourse, the water will come out, but it will stay inside the sac. And that is called Bartholin cyst. If you get infected, that will Bartholin abscess. Get to the hospital. They may give you antibiotics, may subside, or they may operate it.
I say a big thank you to Venerable Dr. Benjamin Okwere for the sacrifice of time that he has given to us. I believe that this time has been insightful, has been impactful. People have gotten answers to their questions. Please, let's start rolling in claps for our doctor, for our gynecologist of 26 years, a doctor of 37 years. Please keep rolling your claps, keep rolling your claps. I want to say thank you, sir. We appreciate you so much. Thank you for touching lives. Thank you for touching destinies. Thank you for helping people to survive. Thank you for bringing smiles to the faces of people that have thought it's the end. We want to say thank you, sir. We appreciate you so much, sir. Thank you very much, sir. We appreciate you. From all of us from Web Woman Hub, we say thank you and God bless you, sir.